Ladies and gentlemen, distinguished ministers, Mrs. Regional Director, we are ready to start our second day. Welcome to the second day of the Eastern Partnership Ministerial Conference on Tuberculosis and its multi-drug resistance. Today is our official day, and we start with the strategy and targets to fight tuberculosis in the European region and now and in the future. With great pleasure, I would like to give the floor for the opening speech to the Minister for Health of the Republic of Latvia, Dr. Guntis Belevič. Welcome.
Honorable Ministers, ladies and gentlemen. Last week we celebrated the 33rd World Tuberculosis Day. The day when we turn the attention of the society to the preventive measures, timely treatment of the disease and treatment possibilities. Though the mortality related to the tuberculosis has been falling since 1990, this problem is still very important. In the European region of the World Health Organization, 360,000 new cases of tuberculosis were registered in 2013, which means that there are 1,000 new cases per day. Unfortunately, there are approximately 460,000 TB patients in the region. This is the second day of the high-level conference organized by the Latvian presidency, aiming to reduce the spread of tuberculosis in the EU, in the EEA, and the countries of the Eastern Partnership. The main priority for the European region is the confinement of the MDR-TB, as currently European region has the highest MDR-TB proportion, and its treatment places a huge burden on the health sector. Currently, the incidence of TB in Latvia is 38.8 cases per 100,000 inhabitants, but we have undertaken to reduce this number as soon as possible to the EU average, which is 20 cases per 100,000 inhabitants, and to have Latvia removed from the list of the 18 countries with the highest incidence of TB. The second important issue in the European region is the cross-border spread of tuberculosis, which is related to the free movement of people. It becomes more and more active on annual basis due to influx of job and asylum seekers to the European Union and EEA countries, as well as due to travel. The main goals of Latvia with regards to the confinement of tuberculosis coincide with those goals mentioned in the planning documents of the World Health Organization and the ECDC. As to the confinement of tuberculosis, Latvia has set the following priorities that also derive from the common European goals. Implementation of the principle health in all policies. In this context, the participation of the Ministry of Welfare, Ministry of Finance, of local and regional governments and NGOs are of great importance. Equal opportunities to receive quality outpatient services both in the cities and remote rural areas. Reduction of inequality and most vulnerable groups. Like in other countries, the risks of TB in Latvia are closely related to social factors. Approximately 37% of all first-time cases come from the unemployed people. 6% of the first-time patients are in detention facilities, 5% inject drugs, 2% are homeless, and 9% from the first-time tuberculosis patients have been infected with HIV. introduction of new technologies to ensure early diagnostics and to improve accessibility to drugs. Responsibility of the society and each individual for his or her health and the health of others. That includes prophylactic or preventive measures and timely visits to doctors to eliminate late detection and the spread of infection. Here, NGOs, including patient organizations, play an important role. We have also set strategic objectives. This includes intersectoral cooperation to eliminate the cross-border spread of TB, sustainable approach and the use of resources to work with vulnerable groups, development of scientific research, and the introduction of latest innovations to confine the TB. TB is one of the oldest diseases in the world, but it is still a topical modern disease. The incidence of tuberculosis is falling, it still endangers a huge part of the society. Everyone who has been in a lengthy contact with TB patients can be infected. Besides, this disease is spread by air, so it has no limits. The good news is that since 2001, the incidence of tuberculosis has reduced in Latvia for more than 50%, falling from 1,792 cases to 776 cases in 2013. Like in other European countries, the incidence of the MDR-TB is also falling in Latvia. Still, we have to do everything to reduce this incidence even further, because one MDR-TB patient can infect 10 to 15 people on an annual basis, and 10% from the infected people develop the MDR-TB. Honorable participants of the conference, last week I presented to the Latvian society my vision on how to ensure a long-term improvement in the public health. We envisage that as a result of this plan, Latvia will be the country with the healthiest people in the world. I have called this plan the Latvian Health Platform 2015-2065. We have 4 directions in this platform, namely free and healthy, to eradicate addictions, live healthy, to introduce prophylactic or preventive measures, move healthy, to promote active lifestyle, and eat healthy, to promote healthy diets. On the basis of this plan, I believe that the incidence of tuberculosis can be reduced by improving the awareness in the society about healthy lifestyles, because the person will or will not fall ill with this disease depending on the immunity of the specific person. Thus, the person as such plays an important role. Namely, if the person has healthy diet, has active lifestyle, doesn't consume alcohol, or is not addicted to nicotine or other addictive substances, he or she may reduce the risk of infection. To ensure early detection, it is important to visit the doctor regularly and perform health checks. Thus, it is important to teach children about health and to introduce health lessons in the schools. I believe that only a set of measures where all individuals are personally responsible for his or her health, where all people have not only rights but also duties towards their health as a public good, where the state guarantees accessible, preventive and health services, can ensure the achievement of our goal: healthy, capable and well-off society. Honorable guests, Latvia is a beautiful country, and I hope that you will keep it in your memories. Please have a look in your folders that you received when you registered today. There you will find a postcard with a stamp already attached, and this postcard has our 4 beautiful seasons: spring, summer, autumn and winter. The postcard is ready for mailing, and here in the hall, you can see a mailbox where you can dispatch the postcard. Maybe you can send some nice message to those that are dear to you and remind to them that health is something of value. Thank you.
Thank you, Minister. And now I'm delighted to invite Dr. Zsuzsanna Jakab, World Health Organization Regional Director for Europe. Please, you are warmly welcome.
Minister Belevich, Excellencies, colleagues, friends, ladies and gentlemen. It is my pleasure to greet you and also to welcome you on behalf of the World Health Organization to this first Eastern Partnership Ministerial Conference on Tuberculosis and its multi-drug resistance. While every year and every moment is important in the fight against tuberculosis, 2015 is a special year, in particular because it marks the final year of the Millennium Development Goals. It is thus a point in time where we closely evaluate the progress that has been made, the challenges that still exist, and the way forward. I would like to commend first and foremost the Latvian presidency of the Council of the European Union, the Ministry of Health of Latvia, particularly Dr. Belevich for his leadership and for organizing this great event at this very important and very crucial moment in time. The question for us today is, can we achieve tuberculosis elimination in our lifetime? Experience with other diseases has shown that disease elimination is possible if we have firm political commitment, financial commitment, and intensified efforts. This, ladies and gentlemen, is the challenge before us in this groundbreaking first ministerial Eastern Partnership Conference on TB in the framework of the European Union. In the WHO European region, over the past decade, much progress has been made in tuberculosis prevention and control, and we can be very proud of this. TB incidence has been falling at an average rate of 4.5% per year. Thereby, we are meeting the Millennium Development Goal of halting and reversing the incidence of tuberculosis. This is the fastest decline in TB rates of all regions in the world. However, this is not enough to achieve the End TB strategy target of 2035 and TB elimination by 2050. For that, we need new point-of-care diagnosis tools, more efficient treatment and vaccine, and we need them as soon as possible. Europe still faces the pressing challenge of multi-drug and extensively drug-resistant tuberculosis. And this is not just a challenge outside the European Union. Of the 18 priority MDR TB countries in our region, 5 are in the EU. In the 1990s, with the disruption of health services after the collapse of the former Soviet Union, TB and drug-resistant TB rates increased sharply and continue to do so also in the turn of the century. In 2010, in order to address the alarming trend, I established a special project and nominated a special representative in the WHO European Regional Office. Our office, in collaboration with member states and partners, including the civil society, developed a detailed plan, namely the Consolidated Action Plan to Prevent and Control Tuberculosis multi-drug and extensively drug-resistant tuberculosis for 2011 and 15. The plan and its accompanying resolution were fully endorsed by the 61st session of the Regional Committee in Baku, Azerbaijan in 2011. Since then, WHO and partners have actively supported member states to fully implement the plan and its related activities. Since 2011, in line with the European Health Policy Health 2020 and in collaboration with partners, we have embarked on several key initiatives, including a health system assessment of TB services, establishment of the Regional Green Light Committee to scale up the programmatic management of MDR and XDR TB, the European Laboratory Initiative, the WHO European Respiratory Society Electronic Consilium to support clinical management of patients whose diseases are difficult to treat, and the Regional Collaborating Committee on Tuberculosis Control and Care to promote working in partnerships and the involvement of civil society in the combat against TB. WHO has assisted member states with conducting extensive program reviews, which were jointly conducted with ECDC for the EU countries based on their request, to provide detailed suggestions for action. In addition to high-level visits and my meetings with heads of states and ministers to ensure the availability of domestic resources and their efficient use, we have also worked closely with the Global Fund and other donors to increase external funding. To this end, and with excellent support of the Secretariat of the Global Fund, a regional proposal for health system management to address health system strengthening on MDR-TB has been submitted. As a result of this work, as well as the rollout of new molecular tests, such as the Gene Expert, we have seen a 40% increase in the detection rate of the MDR-TB, even though more than 50% of the estimated MDR-TB cases still remain undetected. Along with strengthened detection, member states have improved access to treatment significantly. In 2009, of those MDR-TB patients detected, only 60% were put on second-line treatment. Today, I am proud to say that there is universal treatment coverage for all MDR-TB patients who are detected in most member states and all EU Eastern Partnership countries. Alarmingly, the MDR-TB rates among new cases have been increasing. We had foreseen this since those newly infected may develop the disease during their lifetime, particularly during the first 5 years after the infection. Promisingly, the proportion of MDR-TB among previously treated patients seemed to have been stabilized over the past 4 years. This has largely been due to the better treatment and care of new patients and the introduction of new models of care. Ladies and gentlemen, TB was for a long time an orphan disease, with almost no new medicines available. In the last 2 years, with the excellent support of key partners, including Médecins Sans Frontières, we have assisted member states to embark on the rational use of 2 new medicines. Although these medicines are still conditionally approved by the drug regulatory authorities. More research and development is needed to ensure new medicines are discovered and used for TB and MDR-TB. In order to support low TB incidence countries, WHO and the ECDC have jointly conducted country visits and discussed the findings and recommendations with your national authorities, with a view to addressing the needs of the vulnerable populations and moving towards TB elimination. In September last year, WHO, together with the European Respiratory Society, launched a new framework to eliminate tuberculosis in countries with low levels of the disease. This framework was developed by representatives and experts from over 30 countries and territories with a low burden of TB at a meeting in Rome, co-hosted by WHO and EARS in collaboration with the Italian Ministry of Health. Now, in the final year of the Consolidated Action Plan, we need to ensure the continuity of the work and progress that has taken place over the past 4 years by reviewing the lessons learned. With the endorsement of the NTB strategy by the 67th session of the World Health Assembly, Member States, WHO, and the partners are moving forward together in developing a new action plan for 2016-2020 to prevent and control TB and MDR-TB in the European region. The targets, the strategic directions, and areas of intervention of the new plan build on the current action plan and are also aligned with the 3 main pillars of the global end-TB strategy. Within the new plan, we have prioritized the activities that you can see on the slide. First of all, more rapid diagnosis and complete treatment for all patients, expanded patient-centered models of care, a further shift from inpatient to ambulatory care, new TB drugs with shorter and more effective treatment regimens, more equity and reduced stigma, and additional funds which are cost-effectively used. Ladies and gentlemen, we must further boost the progress made in low TB incidence countries and use the success stories and experience to achieve similar successes in the Eastern Partnership of the European Union. Through intersectoral approach, we need to see intensified actions to address the social determinants of health and to ensure equal access to quality care for all patients, not only half of them and halfway. These are the key challenges we face and the challenges we must meet if we are to eliminate TB in our lifetime. I am confident that elimination is possible with more intensified efforts such as those initiated here in the Eastern Partnership. The Riga Declaration is a tangible outcome of this 2-day high-level event, and we should all strive to commit our dedication in our respective organizations and roles and responsibilities to facilitate and foster its full implementation. We should aim to set an example of cross-cutting partnering, producing and encouraging an inspiring bridge to the Slovakian EU presidency for the second part of 2016, when Slovakia has also decided to make TB of its health presidency priorities, thus continuing the legacy initiated by the Latvian government. Ladies and gentlemen, dear partners, dear colleagues, I thank you for your efforts. As always, You can count on full support of myself and my teams in the countries and in the regional office, and we have to continue our work together to achieve a stage where Europe becomes tuberculosis-free for the next generation and for our children. Thank you very much.
Thank you, Dr. Jakob, for your inspiring presentation. And now I would like to announce a video message from Dr. Vytenis Povilas Andriukaitis, EU Commissioner for Health and Food Safety, who unfortunately can't join us in this conference. Start video, please.
Ministers, ladies and gentlemen, thank you very much for your invitation to speak at this very important event on tuberculosis, gathering not only the EU member states, but also our neighbors. First of all, please know that I truly regret not being able to join you in person. Secondly, I would like to thank the Latvian presidency and in particular the Minister of Health for his leadership in putting tuberculosis high on the political agenda. The tuberculosis is a blunt reminder of the health inequalities that remain between social groups. It is a social disease. It often targets the most vulnerable in our society, the socially excluded, those living in poverty, the homeless, the drug users, or the prisoners. Therefore, it is vital to look at the tuberculosis issue from a wide perspective and address the underlying social conditions that encourage its spread. I am a medical doctor. I know that treatment alone is not sufficient. It must come hand in hand with social support. To do this, we need to work together across continents, across the European Union and across sectors, involving many sectors of government, ministries for health, education, internal affairs, employment, law enforcement and more. Higher risk groups can be found almost anywhere. Within some of our big cities, London, Brussels or Barcelona for example, where high infection rates prevail. Indeed, these cities report an annual rate of new infection ranging from 27 to 44 cases per 100,000 people. And 6 European Union member states report high general infection rates, reaching over 83 cases per 100,000 people. It is encouraging that the overall number of new infections within the European Union continues to decline by 5 to 6% each year. However, there is little improvement in treatment success rates. In addition, we are confronted by the threat of drug-resistant tuberculosis. It is difficult to diagnose and treat. This is particularly worrying, as multi-drug resistant forms of tuberculosis are increasing in the wider European region. Only 1 in 3 patients with this form of tuberculosis is treated successfully. More than half die or fail to respond to treatment. In short, progress so far is insufficient. It is not enough to reach the goal of eliminating tuberculosis as a public health threat by 2050. Tuberculosis is one of the priorities in the new European Union health program. In this context, I intend to foster new initiatives to improve early diagnosis and the integration of TB care, and to support EU countries in shaping national plans and guidelines to address TB. On the basis of an assessment of our action plan to fight tuberculosis in the European Union, we need to cooperate on several issues. First, we need to increase prevention and treatment efforts, particularly in relation to vulnerable groups. Second, national efforts need to be underpinned by appropriate resources. In this respect, I urge all countries to devote the necessary resources to action on tuberculosis. Third, we need to facilitate the development of new tuberculosis treatments and vaccines. We need to join efforts and eliminate tuberculosis by 2050. I believe the Riga Declaration provides a solid foundation for joint work and the future collaboration. I am committed and look forward to working with all of you towards our joint goal of eradicating TB in Europe.